The first award for the evening, now in its sixth year, is the Kimpro Gold Standard for Healthcare. It is my privilege to announce our Kimpro Gold Standard 2015 for Healthcare, Dr. Girdhar Gyani. May I now request Mr. Pereira to read a short citation on Dr. Gyani.
Thank you, Subhash. Dr. Girdhar Gyani is Director General, Association of Healthcare Providers India, a pioneer, an evangelist for quality in healthcare. As a pioneer, Dr. Gyani is best known for formulating the National Accreditation Board for Hospitals and Healthcare Providers, better known as NABH standards. In 2005, he rolled out the NABH through a governing board, accreditation committee, technical committee, and assessors. The hospitals accredited by NABH have earned global recognition. Consequently, medical tourism has benefited Indian hospitals. Beyond India, the NABH standard was first adopted by the Philippines. Through the visionary leadership of Dr. Gyani, other Asian countries are evaluating this option. Beyond hospitals, Dr. Gyani extended the accreditation schemes to nursing homes, blood banks, diagnostic centers, dental clinics, and Ayush emergency trauma care hospitals, with astounding results. Dr. Gyani, a tireless crusader. Dr. Gyani served as founder, CEO of NABH until 2012. He is currently a member of the NABH board. In 2012, Dr. Gyani spread his wings even wider. He established the Association of Healthcare Providers India. The association represents the majority of healthcare providers across India. It functions as a not-for-profit organization and advocates with the government, regulatory bodies, and other stakeholders on issues that can reinforce reliable healthcare delivery to the community at large. Dr. Gyani evangelizes the power of continuous quality improvement in healthcare. According to him, it is the oxygen for an organization's health. Dr. Gyani, an institution builder made in India. Let's congratulate Dr. Girdhar Gyani, our Kimpro Gold Standard 2015 for healthcare. Dr. Gyani.
Thank you very much.
Thank you, Mr. Pereira. May I request Dr. Milind Kirtane and Dr. Adi Dastur to present the award. Thank you, gentlemen. Dr. Gyani, may I please request you to say a few words to our audience.
Thank you very much. And good evening, ladies and gentlemen. At the outset, I feel like, very in humility to Suresh, my guide, Dr. Nohria here, sitting here. And I want to convey my sincere thanks and gratitude to the Kimpro Foundation for bestowing me this honor by way of giving this Gold Standard Award in the healthcare. In fact, as I must tell you that my journey in quality started way back in 1982, when I started in the defense R&D, then ventured into the telecommunication, finally came to Quality Council of India, where also Suresh has a role to play because he was in the selection committee, which actually finally selected me as Secretary General, Quality Council of India. Actually, that is the real journey in the world of quality, which I still cherish the way what I could contribute. Now, in few minutes, I like to tell you that quality is a journey with no defined destination, no fixed destination. And I am privileged that I was part of this journey. And it so happened that during this journey, I could venture into the new role of defining the framework for quality in healthcare, first time in the country. That is the kind of, I feel happy that in healthcare we had no framework for defining the quality, for measuring quality, for monitoring quality. And that opportunity came to me in 2004. Not that I was the newcomer in the healthcare. Actually, I started working in the healthcare in year 2000, little earlier than that, when in the part of the NABL, I was trying to define the training standards for surveyor of the medical laboratories. And during that was the time when we came across the report. We used to read this report, "To Err is Human," and Institute of Medicine USA, and which says, that in year 1999, 48,000 to 90,000 patients died in USA alone due to the medical errors. Now, that was the one landmark judgment which was then deliberated widely in the developed countries, but nothing in the developing nations, because developing nations were in fact worried about providing accessible, available, and affordable health care. The safety and quality was nowhere to be seen in the developing nations, And that is where I feel, that India, when this opportunity came to Quality Council of India, which I was heading, and we could establish the framework standard for hospitals or healthcare in year 2004, 5, 6. And that actually gave me all the more satisfaction, because this aspect of quality was a little different than quality in other fields, because this quality means enhancing the patient safety. This quality means saving the lives of the people in the country. And I must say that today with the sense of satisfaction, that today India's hospitals are not known only for affordable health care. In fact, we are also known for the safe health care in the country, meeting the world-class standards. So that is the kind of, starting which we have been able to make. And I am very again happy to say that from 2004 onwards, at least in India, all nooks in the corner, not only the tier 1, tier 2, tier 3 cities, we have been started talking at least about how do we measure the medical quality, how do we measure the sentinel events, what are the medical errors. That awareness which has been generated, I think will take us a long way in the journey of providing safe and affordable health care. Now, at this point of time, I must tell you one thing here, that this great job which actually has been done and for which I have been given this prestigious award by the foundation wouldn't have been possible unless the people, I don't want to name them here, some of them are sitting here, some of them are not sitting here, they worked tirelessly, passionately, day and night to create this world-class standard. I think this award actually also goes to those people who worked then and even continue to work now. So I think that is the kind of very special field which has been created. Finally, I want to say here that even at this age, award really motivates. So I want to say, that I want to convey thanks to the Kimpro Foundation trustees, judges, jury members, that this recognition will keep me more motivated and keep on working till I am able to work, God willing, And finally, one thing which I was deliberating with my friends when they learned that I am going to receive this award. They say receiving award nowadays is not that important, but returning back award is more important. I said, come on, this award is being given to me by some of the best brains in the healthcare, and there is no way I'm going to return this award. Thank you very much.
Thank you for that passionate speech, Dr.